Hello dear colleagues, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 67-year-old man with a history of Parkinson's disease presents due to the development of an itchy red rash on his neck, behind his ears and around the nasolabial folds. He had a similar flare-up last winter but did not seek medical attention. What is the most likely diagnosis? A. Levodopa-associated dermatitis. B. Seborrheic dermatitis. C. Flexural psoriasis. D. Acne rosacea. E. Fixed drug reaction to ropinirole. Okay, here we have a 67-year-old patients with a history of Parkinson's disease coming with their itchy red rash on his back, behind his ears and around the nasolabial folds, which we can say that it's a seborrheic dermatitis. Seborrheic dermatitis is usually common in patients with Parkinson's disease. Okay, the answer can be seborrheic dermatitis. Here we are going to explain it. Seborrheic dermatitis is more common in patients with Parkinson's disease, and it's common also in patients with HIV disease. Seborrheic dermatitis in adults. Okay, seborrheic dermatitis in adults is a chronic dermatitis thought to be caused by an inflammatory reaction related to a proliferation of a normal skin inhabitant, a fungus called Malassezia furfur. Okay, the responsible is Malassezia furfur. It's common, affecting around 2 to 5% of the general population. Features of seborrheic dermatitis: eczematous lesions on the sebum-rich areas like scalp and may cause dandruff, periorbital, auricular, and nasolabial folds, as we can see in our patients. He's coming with erythematous lesions around his periorbital, auricular, and nasal in his scalp, periorbital, auricular, and nasolabial folds. Okay, otitis externa and blepharitis may also develop. Okay, associated conditions, as we said, it's common in patients with HIV and Parkinson's disease. Okay, scalp disease management. The management of scalp dermatitis, seborrheic dermatitis. Okay, after the control preparation containing zinc, pyrithione, for example, Head and Shoulder shampoo and a tar or nitrogen tea gel shampoo are usually first line for scalp seborrheic dermatitis. The preferred second line agent is ketoconazole shampoo. Selenium sulfate and a topical corticosteroid may also be useful if the treatment with over-the-counter preparations is not preventing the condition. Selenium sulfate and a topical corticosteroid will also be useful. Face and body management: topical antifungals, in example, ketoconazole and topical steroids, best used for short periods and difficult to treat recurrence, are common in face and body seborrheic dermatitis. Okay, here we can see seborrheic dermatitis in different parts of the different patients. Here we can see seborrheic dermatitis in the mustache, around the face, and in nasolabial fold in this patient. Here we can see post-auricular seborrheic dermatitis in this patient. Here we can see the involvement of whole the ear, the face, and the scalp of this patient with seborrheic dermatitis. In this patient also we can see involvement of the face, beard, and the mustache with seborrheic dermatitis. Here we can see severe seborrheic dermatitis of the scalp in a baby. Here we can see seborrheic dermatitis in the eyebrow of this person. Okay, this was a short explanation about seborrheic dermatitis and its management. And thank you for your attention.